What's happened really in the last 5 years is the genesis of a very directed approach on how to take care of patients, and then it falls into a couple different areas. One would be in targeted therapy, so we're able to identify molecular protein targets for treatment, exploit those with designer drugs that only affect that area, spare the patient toxicity, and give them the benefit. I think the other area very exciting right now are some of the immune-based therapies that we're using. So we're harnessing the patient's own immune system to recognize cancer cells and kill them off, often again with very good tolerability and low toxicity. So now, instead of a non-directed approach, it's a very direct approach. And the benefit of that is better outcomes, better toxicity, better quality of life for patients. So while we're not curing everybody of cancer, we're seeing many long-term survivors now. Patients are doing, really excellent in terms of quality of life, and really, again, enjoying those milestones in life we all do. One of the issues that's really come about now is the diseases that were often uniformly fatal no longer are. I mean, in my clinic, I have 2 patients who are 5-year survivors right now in complete remission with metastatic melanoma. One is a young gentleman, he's about 48 years young, so he's enjoying a normal lifespan, and forever how long that occurs, fantastic. We have patients where in the past that would be somewhat blunted in terms of their capacity to do things. That specific individual works a full-time job, is married, cares for his family, and it really it's very for me satisfying to see that kind of a big change and somebody to move forward. One of the things we're very proud of is the platform that we share along with Sarah Cannon in terms of bringing really the latest and most highly developed oncotherapeutics to small communities throughout the state of Florida. We're able to really, again, leverage that position in terms of our clinical trial platform. Right now, running approximately 60 to 70 clinical trials throughout the state, and bring those drugs, of which many of those get approved by the FDA, but maybe a year or 2 out. So it allows people to receive those drugs in a very timely manner and hopefully gain the benefit from those drugs. I think the other thing that we're extremely proud of is really our commitment to the community. So we're in many small communities throughout the state and some large ones. And one of the good things is that we're there in a very present way. So big contributors into local charities, bringing our own foundation, which is an outstanding part of our organization, realizing that about 30% of the funds in the foundation get actually redistributed to patients who aren't even in our practice. So the presence we have transcends our own patients that we treat. It really is a commitment to the community. I think my happiness is job satisfaction, my family, my faith. Those things all together, I think, allow me to approach the day in a very fresh manner every day with some enthusiasm, some energy. I know I have a responsibility. The responsibility is to make sure that people sometimes with very serious diseases are cared for, and that things go just about as best as they can. Sometimes they don't always end like we want them to, but again, without that kind of energy that you have to bring to the job, I don't think you can be successful in this area of discipline of medicine. So I would think many of our doctors are very similar. Maybe always the eternal optimist and the glass is half full, but I think that's almost required of a medical oncologist because of the nature of our job. But for me, it's all the things that make me up as a person that allow me to approach a job with that kind of hopeful energy. And sometimes at 8 o'clock at night, I have a little less energy.